The costal cartilages are bars of hyaline cartilage that serve to prolong the ribs forward and contribute to the elasticity of the walls of the thorax. Costal cartilage is only found at the anterior ends of the ribs, providing medial extension. Differences from ribs 1 to 12. The first 7 pairs are connected with the sternum. The next 3 are each articulated with the lower border of the cartilage of the preceding rib. The last 2 have pointed extremities, which end in the wall of the abdomen. Like the ribs, the costal cartilages vary in their length, breadth, and direction. They increase in length from the 1st to the 7th, then gradually decrease to the 12th. The breadth, as well as that of the intervals between them, diminishes from the 1st to the last. They are broad at their attachments to the ribs, and taper toward their sternal extremities, excepting the first 2, which are of the same breadth throughout, and the 6th, 7th, and 8th, which are enlarged where their margins are in contact. They also vary in direction. The first descends a little to the sternum. The second is horizontal. The third ascends slightly, while the others are angular, following the course of the ribs for a short distance, and then ascending to the sternum, a preceding cartilage. Structure. Each costal cartilage presents 2 surfaces, 2 borders, and 2 extremities. Surfaces. The anterior surface is convex, and looks forward and upward. That of the first gives attachment to the costoclavicular ligament and the subclavius muscle. Those of the first 6 or 7 at their sternal ends, to the pectoralis major. The others are covered by, and give partial attachment to, some of the flat muscles of the abdomen. The posterior surface is concave, and directed backward and downward. That of the first gives attachment to the sternothyroideus. Those of the 3rd to the 6th inclusive to the transversus thoracis muscle, and the 6 or 7 inferior ones to the transversus abdominis muscle and the diaphragm. Borders. Of the 2 borders, the superior is concave, the inferior convex. They afford attachment to the intercostales interni. The upper border of the 6th gives attachment also to the pectoralis major. The inferior borders of the 6th, 7th, 8th, and 9th cartilages present heel-like projections at the points of greatest convexity. These projections carry smooth oblong facets which articulate respectively with facets on slight projections from the upper borders of the 7th, 8th, 9th, and 10th cartilages. Extremities. The lateral end of each cartilage is continuous with the osseous tissue of the rib to which it belongs. The medial end of the first is continuous with the sternum. The medial ends of the 6 succeeding ones are rounded and are received into shallow concavities on the lateral margins of the sternum. The medial ends of the 8th, 9th, and 10th costal cartilages are pointed, and are connected each with the cartilage immediately above. Those of the 11th and 12th are pointed and free. In old age, the costal cartilages are prone to undergo superficial ossification. Additional images. See also costochondritis, rib, sternum. This article incorporates text in the public domain from the 20th edition of Gray's Anatomy, 1918. Link to picture.